Some people become stiff as they age. Not in a back in my day, this is how we did things way, but physically stiff. It's a little more difficult to bend at the knees. Your fingers don't grasp objects quite the same. And woe is you if you try to move in a way your back doesn't like. There's a reason you don't see many geriatrics doing backflips. This stiffness can extend past our joints and our muscles. Stiffness can also occur in the valves of our heart, causing a heart murmur.
The most common heart murmur as we age is a thickening of the aortic valve. That's the valve that opens and closes to let the blood leave the heart and go through our body. Just like we get arthritis in our hands and our elbows, this valve gets thickened and arthritic and may have trouble opening. As it has tremendous trouble opening as we age, in a modest percentage of people, it may be difficult for the heart to get the blood to the body. And one can get short of breath, one could faint, one could get chest pain from the heart squeezing too hard to get the blood out.
For many people, the only sign of a heart murmur is just that, the murmur. When the valve is sticky and blocking blood flow, it creates an abnormal sound that your doctor can hear through the stethoscope. That's how heart murmurs are initially diagnosed. Doctors can usually tell if the murmur is innocent or suspicious based on the sound it makes. Doctors will hear the telltale murmur of aortic stenosis in one of 3 elderly people.
Predominantly, it's an aging situation. Occasionally, it's genetic. There are some people, the aortic valve is supposed to have 3 leaflets. A small percentage of people are born with a normal variant where there's 2 leaflets instead of 3, where it opens and closes, we call it bileaflet. Those people, the flow over the years has more of a risk of causing early calcification, and sometimes in their 60s rather than 80s or 90s, the valve may start becoming calcified. So there are genetic factors that increase the risk of aortic stenosis. Predominantly it's age, but it is more a calcified arthritic situation.
If the physician hears something suspicious, they can order a sonogram of the heart, called an echocardiogram. That will reveal aortic stenosis if it is present. Then we can consider what needs to be done.
Usually for aortic stenosis, we observe. We listen to the murmur, we ask patients how they're feeling, we look for warning symptoms of shortness of breath, chest pain, feeling faint, how's your stamina, watch the EKG, and so it's observed with asking patients how they're feeling, looking at their EKG, occasionally doing a sonogram of the heart or echocardiogram. If at some point we think that the valve may be severe based on the echo or symptoms, then at that point we would recommend a test in the hospital called an angiogram or cardiac catheterization to precisely measure how the valve is working.
Unfortunately, there aren't any medications that can melt the calcium that's developing on the valve, just as we don't have a medication that can melt the arthritis in your fingers. Calcification of the valve becomes severe, then the only course of treatment is to replace the heart valve with surgery.
The scientists working with the cardiologist have in very recent times been able to create a valve that slipped into the heart through your groin, just as if an angiogram of the heart, just a small catheter with a valve on the tip of the catheter that's placed in the middle of your old calcified valve and then dramatically opened up like an umbrella to squish the old valve, put the new one in place. It's not as good as brand new, but it's dramatically better than the calcified valve that was arthritic.
There's no way to prevent aortic valve stenosis. It's just something that happens. However, anything you can do to keep your heart healthy will help. That valve may be stiff, but there's no excuse for the rest of your heart to slack off. Engaging in regular, moderate exercise, eating a heart-healthy diet, and keeping your cholesterol and blood pressure under control will always be good for you, sticky valve or not. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.